Well, then we'll call the Committee on Health and Human Services of the Wayne County Commission to order. Welcome, everybody. Oh, Commissioner Baker McCormick.
Yes, I'm here.
Yeah, I see. I'm going to keep doing it the same way I did before, Commissioner. As Vice Chair, you'll get the first round of questioning. Then we'll go around the horn. And then any other commissioner after committee members have asked questions. We have a presentation today from 4 of our providers. They're providing mental health services, and they have a PowerPoint. I'm going to allow all 4 of them to present, and we're going to wait on questions until all 4 are done. And then we can have questions for the providers. Then we'll have another little presentation from the CEO of the Mental Health Authority that will talk about some additional issues, and then we'll have a question period for him. And if that's okay with everybody, we'll move the agenda. Madam Clerk, can we do the roll, please?
Commissioner Marecki?
Here.
Commissioner Daub?
Here.
Commissioner Anderson?
Here.
Commissioner Baker McCormick?
Here.
Chair Colleen?
Present.
You have a quorum present.
Do I have any other commissioners that are not on the committee that are present for the meeting? Okay, because I don't want to leave them out. All right, Madam Clerk, let's go to item B on the agenda, please.
B, approval of the June 9th, 2020 meeting minutes.
Move approval. Anderson.
Support. Go ahead, Terry.
Yeah. We got it, Anderson and Marecki. It's been moved to approve the minutes. Are there any additions, corrections, changes? Hearing none. We have a motion before us. All in favor of the motion, please say aye.
Aye.
Opposed? Okay. Let's go to item C, Madam Clerk.
C, old business. There is none.
Well, let's move to new business then.
Item D1, under new business, requesting commission approval of a grant acceptance with the Michigan Department of Health and Human Services, Division of Emergency Preparedness and Response, Bureau of Emergency Medical Services, Trauma and Preparedness.
Okay. Who from administration is going to lead off with an explanation of this?
Hi, this is Carol Osterberry from the Wayne County Health Department Health Officer.
Welcome, Ms. Osterberry. Thank you for being here.
Yes, thank you for having me. And yes, this is, as it was described, emergency preparedness money for COVID-19. We will be using this for contractual services for surge nursing capacity. And we also are using the money for advertising for the Save a Life campaign that got launched over at Garden City Hospital this morning. Miscellaneous equipment, freezer for a actual freezer that we would need for vaccine. And then we have in the field computers that have to go out, and they need very special like hard case bags. And that's the other thing that we're going to be spending this for.
Okay, and I don't know if you're going to hang around, Ms. Osterberry, but I did get a hold of Andy Kondravas. So under some such other matters, hopefully we can talk about what's happening at Garden City Hospital today with that announcement.
Yes, absolutely.
Okay, so this is what it's for. We'll go to questions from commissioners. Vice Chair Baker McCormick, you're up.
No questions, thank you.
All righty, Commissioner Anderson, you're next.
Nothing at this time. And I was there at Garden City this morning, so it was a good program, a good rollout, and very beneficial.
Well, if Ms. Osterberry doesn't hang around for the duration, you can tell us under some such other matter. Commissioner Dobb, questions?
No questions for me. I did go and get tested at the drive-through at Garden City Hospital, I think 2 weeks ago, and it was quick and easy and relatively painless. So I'm glad that the county is offering this to all of the residents.
All righty, and Commissioner Marecki, please.
Thank you, Mr. Chair. I just have one question. Carol, so is this out of any of the funds we've already gotten or received rather, or is this just a whole separate grant that's coming in for this?
Oh, yep, nope, you're right. Exactly what you just said. It's a whole separate other money coming in
Okay.
for COVID-19 response. Yep.
Okay, it's so hard to keep track of everything that's coming in and out.
Oh, I know.
Okay, thank you. That's
Thank
it.
you.
Yeah, you're right, Commissioner Marecki. I think we probably need a separate spreadsheet or something at some point for all these various to really see what's coming and going in the county. I have no questions. What's the pleasure of the committee on item 1, D1?
Move approval.
Support, Dobb.
Anderson and Dobb have moved and supported. Are there any other questions? Hearing none, we'll go to a vote. All in favor of the motion, please say aye.
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 Opposed? Any abstentions? Hey, Julian. All right, the motion passes. Madam Clerk, item D2, please.
Item 2, requesting commission approval of a retroactive 3-year agreement with a 3-year option to renew with Oakwood Healthcare.
Thank you, and I'm gonna guess that this is Ms. Osterberry as well.
Yes, this is our contract for the outpatient clinical services for residents of Wayne County who have TB or tuberculosis.
Okay. In the past, Oakwood has had this contract, but what's different now is between the last renewal and this one, Beaumont bought Oakwood. So the contract is kind of with Beaumont now, is that correct?
The actual term on the contract says Oakwood Healthcare, Inc., doing business as Beaumont, I think is how it's listed, yes.
Okay. All right. So that's a slight change, but we've been doing this work, the tuberculosis work at Oakwood for a number of years now.
You are correct.
Thank you. All right, we'll go to questions. We'll start with the vice chair of the committee. Commissioner Baker McCormick, please.
No questions. Thank you.
All righty. Commissioner Anderson?
If I could, through the chair, Carol, how many patients do they typically see, or do we get a report on how many there? It looks like 67 of that. That's the solicitations on the bid, but I don't think I recall seeing how many patients they have been treated.
Right. On an average, every year, we see between 25 and it can go up to 40, but it's more, as far as active patients that actually have active TB.
Does the number seem to be going up or down?
Over the years, they have gone down, yes. And a big part of that is, quickly identifying people who have symptoms of TB and getting them into this program, and then they don't become active. It's not classified as an active case. So we certainly we work with many more every year, but the active TB cases are 25 approximately per year.
Okay. All right. Thank you.
Mm-hmm.
Commissioner Dobb?
No questions for me. Thank you.
Thank you. And Commissioner Marecki?
No questions for me as well. Thank you.
Yeah, next time I'm going to reverse this. You'll go first, Marecki. Just, it's like being back in school again. How come you always call my name last on the roll? Is TB on the upswing, Ms. Osterberry, our health officer?
I don't think that it is on the upswing. It is certainly, worldwide and here, it's here, but upswing, no, we do not consider it on the upswing.
Yeah, because being a former public school teacher, there was great care given in the public school system to make sure everybody's up on their TB, and I thought I had heard that it was starting to creep back up again. And can you speak to the fact that this is retroactive?
I can tell you all that I worked with 4 different attorneys with the whole Beaumont, Oakwood, and it seemed anytime I started with a different one, it was starting from scratch again. That's the sheer administrative reality of why this took a long time to get through the system.
Do you remember when did Beaumont take over Oakwood?
I don't remember, and like I said, it was very difficult to figure out who was the right person, who we needed to talk to. I think they had a lot of retirements and then just, lack of that institutional knowledge and, oh, what is this? And we struggled to try and find the right, individual, the right department over there who to work with on this. And that was when I say us and Corporation Counsel from Wayne County.
Yeah, okay. Since it is a retroactive contract, have they started any of the work underneath this contract?
Well, because they're the same contractor, we have not stopped services for those clients.
For the ongoing clients?
Correct, right.
But they haven't done any new clients under a new agreement?
No, but like I say, we have not stopped any services.
Okay. I saw Mr. Rainwater from commission staff come on for a sec there. Mr. Rainwater, did you have a comment?
No, sir. No, sir.
All righty, thank you. What's the pleasure of the committee on item D2?
Move approval. Anderson.
Support Marecki.
Thank you. Any further discussion of this item? Proper motion that's been seconded. Any all in favor of the motion, please say aye.
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 Aye. Opposed? Are there any abstentions? All righty. All right. So next on the agenda, Madam Clerk.
3, a discussion with mental health providers.
Yeah, thank you. I was contacted a few weeks back. There's a group in Michigan called the Michigan Behavioral Health and Wellness Collaborative, and they're nonprofits dealing with health and wellness all over the state, and a lot of big ones, a lot of big providers. A number of them are providers in the Detroit-Wayne Integrated Health Network, the old mental health authority we used to call it. And they contacted me via an email, and the title on the email was The Silent Healthcare Crisis in Wayne County, which indeed we have with the funding. And now that we're in the era of integrated health, where everything, substance use disorder, mental health, physical health, or however you want to define those things, are now all together under one roof. So we are in the integrated health era. And I think I will go first. So we'll get presentations from 4. I've asked people, 5 to 6 minutes or so for each one at max. And if we can go through the 4 presentations, and commissioners, if you could hold on to your questions, and we will do the questions after the presentation and the PowerPoint. Are we able to see the PowerPoint for everybody?
1 second, I'm gonna pull it up right now.
There's everybody.
1 second.
Candravis, what are you doing in Greece? Hey, there we go. All right. So if I may, at this point, call on Catherine, I believe it's Leisman. Pardon me? Leisman. Of course I messed that up. And I took German in high school. She was the CEO of the Development Centers and co-chair of the Behavioral Health and Wellness Collaborative. So Ms. Leisman, thank you very much for contacting us. This is an important discussion to have. We need to hear right from the ground level of what's going on out there. So I'll turn it over to you, and if you can kind of, act like introducing the next person after you present as well, if that would be okay.
Okay.
Your meeting, Ms. Leisman.
Okay, thank you so much. So good afternoon, commissioners and their staff, and also guests. And my name's Catherine Leisman, and I am the co-chair of the Michigan Behavioral Health and Wellness Collaborative and the CEO of Development Centers, which is a multi-service nonprofit that provides comprehensive behavioral health services to over 6,000 children, adults, and their families in Detroit and Wayne County. And I first want to thank you for what you do for the citizens of Wayne County. And we appreciate your time this afternoon so that we can share some of our critical issues. What I'm going to speak to, my remarks are not going to match up necessarily to the slides, but I'm going to ask if we could kind of move along as we get to certain points. The Michigan Health and Wellness Collaborative is a 17 nonprofit providers of behavioral health and SUD services. And so there's the next couple of slides down. You will show all of the different providers that are part of the collaborative. Do I have the capability of moving? Maybe I do. No. Oh.
I have to. Can staff, if you can give the number on the PowerPoint of the slide, I think you're talking about slide 4.
That's
it has
correct.
all the logos. Can staff, if we say to staff, slide 5, please, slide 4, can you do that?
Okay, so it's slide 4 if you can get to it. As I said, we're 17 nonprofit providers, and we provide about 80% of the services to the 75,000 persons that are served by Detroit Wayne Integrated Health Network. And these services range from specialty services in autism to traditional outpatient to rehabilitation to recovery services, and they're provided in the office, in the home, in the community, in schools, and in residential settings. So I'm going to give you a little background that's pre-COVID to help give you a complete picture of the issues that we have. First of all, many of you know this, but Michigan's behavioral health system has been systematically underfunded for several years, even prior to the COVID-19 pandemic, which has been exacerbated with the situation that's put the PIHPs, CMHs, and providers in financial risk and jeopardy. The underlying funding in 2019 and earlier didn't reflect the growing need of the citizens of Michigan who have opioid issues, increased suicides, the cost of the expansion of the autism benefit, jail diversion, or re-entry of citizens to society, homelessness, and general stigma. Part of MDHHS is fully aware of this, and in some part is due to their underfunding of the system as a whole. This includes in large part the underfunding of persons with the expanded Medicaid benefit or Healthy Michigan that have higher need for intensive services, but MDHHS doesn't provide a higher per member per month rate to the PIHPs to provide the care, even when it's medically necessary. Other issues with the state include the state not funding risk reserves, cuts in general fund that would serve indigent or local efforts, and the lack of ability to have any savings at the PIHP, CMH, and provider levels. So we share all this to set the stage for the perfect financial storm in Detroit Wayne and the Detroit Wayne Integrated Health Network and MDHHS with the onset of the pandemic. Providers switched very quickly to telehealth services. However, the transition took resources and training and also education of our consumers and their families. Consequently, claims-based telehealth services are lower to our providers by 25 to 30% of regular historic level. Telehealth requires that there is some level of privacy and technology, and not all consumers or their families are able to accommodate this. Telehealth also requires ongoing resources and funding to adequately operationalize now and in the future. Many providers continue to operate face-to-face with medication and injection clinics to provide some services to those who were in need of it, including intakes and evaluation, crisis, and community-based services such as ACT, and case management for housing. We have really been the invisible front line of healthcare to the most vulnerable consumers and their families. Clubhouse and skills programs are closed, but members are being served by case management or through groups using technology. But no combination of these services match the historic claims level of previous months. All children's and IDD services are fee-for-service, so that makes their transition even more difficult. This model of fee-for-service, which is the majority of the providers' payments through Detroit Wayne Integrated Health Network, doesn't work well in this environment and puts the financial risk at the provider level, who have the least amount of resources. And this is why we requested historic levels of payment and other methodologies. Providers have had layoffs and program closures. We've had people who have died from the COVID. We've had staff members who've been ill and passed away. So there is a lot of trauma and loss, and we know and expect many more persons are going to need our services as shelter in place is truly lifted. People are going to be coming out, and they're going to seek more services due to their anxiety, depression, and the trauma they have experienced. The state of Michigan received over $3 billion for COVID relief, and yet only $5 million was targeted for behavioral health. And so far of that, Detroit Wayne Integrated Health Network has only received $500,000, which is not enough to address increased need for PPE, telehealth, and alternative crisis resources. Detroit Wayne Integrated Health Network needs funding from MDHHS to push out to providers these historic fee-for-service levels, and also provide emergency resources for telehealth, for PPE, and crisis. Even these at the historic levels, it wasn't really adequate to fund our psychiatric services and our providers. We were already at risk before the pandemic. Provider boards need some level of assurance that they, to wait before they have to make more layoffs or staff reductions, given these financial risks and challenges. In the long term, more program and staff reduction will further weaken the safety net that all of your constituents use, and all of them will probably need at some level going forward. And it is most needed at this time. So I'm speaking about the whole system. I'm speaking about what, in terms of the ask, what we really need is your support to go to MDHHS to push out those COVID dollars to behavioral health, and to also think about more dollars to get to that historic level. Next, you will hear from Marissa Nicely, Vice President for Clinical and Youth Services at Starfish Family Services, on specific children's issues.
Can I step in before Ms. Nicely starts, please?
Sure.
I want to ask commission staff, is there somebody on commission? Yes, that's what I'm talking about. Ms. Nicely, if you could tell us which slide you want to start on.
1 second. I'm not sure why. I've been moving through the slides during her whole presentation, but I was told that you all couldn't see it. I'm not sure why that is. I don't know if it's because I had it on the big screen. Maybe I have to keep it on this little screen right here.
Well, I think everybody can see the slides now.
Okay.
Could I,
sorry?
Commissioner Colleen, could I just interrupt for a second? And I
Sure.
could quickly go through what the slides mean, and then Marissa can start. There is a slide specific for her.
Okay, so where would you like to start, Ms. Leisman?
So number 4, if you could just show number 4 for a second.
Yes.
So those are all the providers in the county that are providing services and are part of the collaborative. Number 5 shows the number of programs that had to be closed during COVID in terms of the impact, people who lost their jobs, and consumers that had a COVID-related death, which is of course very tragic, and the ripple effect has been very difficult for the families and our providers. Number 6, this is much of what I spoke about, and I want to only add here that we've opened urgent care sites, And we are still, we're just working, and we had a lot of these resources for PPE that provided these things either at low cost or no cost to us. Number 7. And then these are some of the challenges that we talked about, and some of my other colleagues will talk about those challenges as well. So, and then number 8. There we are. There's Marissa, if you want to take it away from there.
Sure, thank you. So thank you, commissioners, for your leadership, especially through this crisis, which has hit our community here in Wayne County much more significantly than in other places in the country.
Name and title, please, ma'am, and then go.
Yep, I'm Marissa Nicely, the Vice President of Clinical and Youth Services at Starfish Family Services. We're an Inkster-based, we're an Inkster-based family service agency, and I have been asked to provide the voice of children and children's providers in today's discussion. So in response to the governor's stay-at-home order and the COVID-19 emergency, in behavioral health in general, we did get relatively quick guidance and approval on transitioning many of our services to telehealth, which was really helpful. Unfortunately, as of this date, we have not gotten any other significant financial relief flexibility to support the children in our care and to ensure that our workforce is protected and sustained. All children in Wayne County and most of our adults are model. We provide a unit of service and then we get paid. With the flip of health, our service contract and volumes dropped overnight by 40%. For Starfish, that means we were down about $1 million in revenue in the first several weeks of the crisis.
Let me stop you. I'm hearing noise at my end. Is there somebody that needs to mute? Am I the only one hearing the background noise, which makes it hard to hear?
No, we all hear it. If they can mute everyone else, that would be helpful.
Okay, I'm
Thank you, Commissioner. Ms. Nicely, I'm sorry. If you want to back up just a little bit, and hopefully we can just let you run then.
Sure. Is this better?
Oh, yeah.
Okay. As I was saying, all children in Wayne County and most of our adults are served through a fee-for-service model. So we provide a unit of service and then we get paid. With the flip to telehealth, our service contacts and volumes dropped overnight by 40%. And for Starfish in particular, that means we were down about $1 million in the first several weeks of the crisis. So why are volumes down collectively in children's services? Starfish and its partner child provider agencies have found through targeted survey data that many families do not have access to adequate technology, equipment, or data plans to participate in telehealth. Many of them live in environments that are not conducive to private conversations, and children and their families are just so overwhelmed by this crisis. We have found that many of the parents of the children in our care are essential workers, and they're struggling to balance their work and personal safety with the needs of their children. So as a result, most of Wayne County's children's behavioral health providers are in a financial crisis. A fee-for-service model was never designed to function during a public health emergency. Many other states have put guidelines in place to provide a safety net for their mental health providers, but this has not fully happened in Michigan. And it is actually very devastating to the provider network right now, especially in Wayne County, where the need is the highest. So as a children's network in Wayne County, we're working incredibly hard to support children and families through this situation where we are encountering and trying to mitigate situations that are just truly heartbreaking. So think of the children who have been quarantined and isolated with people who are often the source of their trauma or behavioral challenges. Think about parents with their own mental health concerns that are struggling to be there for their children while managing their own conditions. Think about new mothers facing postpartum depression alone with no access to respite or relief. So with the financial crisis created by the situation, all children's providers are looking at or have acted upon layoffs, which mean program closures or reductions. Without financial relief at Starfish in particular, we are currently looking at laying off 30 master's level clinicians. This would translate to approximately 600 children that would no longer have access to our services. The Children's Center is closing its autism program as of June 30th due to financial constraints. This closure will eliminate the only Medicaid-funded center-based autism program for autistic children in the city of Detroit. Wayne County children's providers were already experiencing a serious workforce shortage prior to COVID-19. Providers were struggling to recruit and retain enough clinicians to meet the demand, and there was focused work happening in this area. A major concern to us is that program closures and layoffs will further discourage children's behavioral health professionals from working in Wayne County, and significantly exacerbate the workforce shortage. As a collective, we are so worried about our families, especially those we have not been able to reach during these past few months. And we are so worried that once the COVID-19 situation improves, we will see an unprecedented mental health crisis in its wake, and then just be unable to respond, especially with the dramatically increased need for children's behavioral health services coming up in the fall. Our schools are going to need our support to acclimate children to new learning routines and environments. Our teachers will need support addressing behaviors caused by months of fear and isolation. The medical community will need our guidance on how to address childhood trauma that presents as physical symptoms. The child welfare system will rely on us to help stabilize placements for foster children, and we will just not have the capacity to meet these needs. Many of us were very pleased to receive PPP loans, but they will only help support us during a short period. We desperately need help from our local and state funders to help stabilize the situation. So I echo Ms. Leisman that the Detroit-Wayne Integrated Health Network needs funding from MDHHS to push out to providers the historic fee-for-funding levels, and also to provide emergency resources for PPE for staff that will have to venture into the field to reach and re-engage our families in the coming months. We ask that you work with us to help determine a path to sustain the network that supports the health and the well-being of our most precious asset here in Wayne County, our children. So thank you for your time. And next you will hear from my colleague, Brent Mikulski, the CEO and President of Services to Enhance Potential, who will speak to issues specific to skill-based support and IDD services.
Good morning, good afternoon. Next slide, please. Good afternoon, and thank you, commissioners, for your time today. We really appreciate the opportunity to talk to you a little bit about everything that's going on within the Behavioral Health Network. As mentioned during the intro, my name is Brent Mikulski, and I'm President and CEO of Services to Enhance Potential, a vocational support provider that has served Wayne County residents since 1972. Since that time, we provided services to roughly 1,500 folks and individuals every year. Early in the COVID-19 crisis, most of the skill building and support employment programs throughout the county were suspended as a result of various executive orders signed by Governor Whitmer. While these orders played a significant role in protecting the lives of the residents for Michigan, it completely decimated the opportunity for disabled individuals to participate in programming that was historically offered. In addition to the suspension of our day program services, we saw over 185 of the individuals that we were able to place in a competitive employment during 2019 lose those jobs because the businesses that they were working for were forced to close. Many of these consumers are still waiting at home, anxiously awaiting that call to return to work. The financial impact of these issues were approximately a reduction of $600,000 monthly for Services to Enhance Potential alone. While most face-to-face services were suspended early in the crisis, a few of our services were able to be converted to telehealth rather quickly, as Marissa had mentioned. With the tremendous amount of advocacy and leadership from Detroit Wayne and the state of Michigan's Department of Health and Human Services, historically face-to-face services were transitioned to telehealth in about 48 hours. Our support coordination and support employment services began immediately to provide these necessary engagement, support, and other discussions with our homebound consumers. In April, we were able to begin our skill building services virtually in a virtual classroom using Zoom and some other platforms to about 200 of the consumers that we previously served. The response of these services by the consumers and their families were extremely positive and still continue to receive a whole lot of attention. We are continuing to add these virtual opportunities to the services that we provide every single day. With several of the stay-at-home restrictions being lifted throughout the last few weeks, our face-to-face programming has been reopened. However, when we consider the social distancing and other health and safety concerns previously provided occupancies that will no longer be possible in those previously provided settings. Classroom and community programming occupancies are estimated to be cut by about 50%, significantly limiting the number of training and support opportunities that can be offered to those in our program. Transportation that was once provided through public and private relationships has been drastically impacted. We are now forced to transport fewer individuals in vehicles and with limited public transportations for door-to-door transfers. We're facing that perfect storm of our inability to get folks to and from work sites and other programs. To help address these issues, that I've mentioned, we've taken the following actions. We've increased our number of hours of programming to roughly 10 hours per day to permit individuals with the flexibility to come and go when they are able. Staggering start and end times to help transportation drop off and pick up points. We added evening and weekend programming to permit even more individuals to participate in community-based and classroom training activities. We coordinated the distribution of tablets and other devices to increase the access to virtual programming to individuals who are still homebound or unable to participate in face-to-face programming due to items out of their control, including the transportation issue that I mentioned. We increased our employer engagement with those businesses that were previously employing those 180 individuals, trying to get them back to work or engaging them to develop a plan to get them back to work. We developed a comprehensive return to work reopening playbook for our staff to follow that outlined increased protocols that were put into place to help protect our employees, consumers, guests in all of our buildings and all of our programming. Our payroll protection program funding exhausted this week. We are now faced with the reality of reduced revenue expectations for the remainder of the year and a looming 7% rate cut on top of these lower revenue projections. We are expected to see in our June Medicaid revenue to be 63% lower than the amounts received prior to COVID. We are extremely proud to have compensated the majority of our 170 employees who have averaged lengths of service exceeding 22 years, approximately 48% above the direct care average wage paid throughout the state. We are now fearing that these numbers of highly dedicated staff will be losing their jobs if the funding is not restored. We hope that leadership of the state of Michigan and other entities will hear the pleas of the providers and continue to support behavioral health provider networks that continue to be the silent safety net for the residents of Michigan. Thank you again in your support that you can provide. I think I'm passing it on to Carol now, I believe.
Yes.
Yep, thank you.
I think you're on mute, Carol.
Oops.
Now you're on.
Thank you. I should know that by now. I should be a Zoom expert. But anyhow, I will start again. I apologize for that. My name is Carol Zuniga, and I'm the Executive Director at Higuera Health. And I just, like my colleagues, want to thank you all for this time and opportunity to be able to tell you from our firsthand experience about what our community, our behavioral health community has experienced through COVID-19. Higuera Health started out as Higuera Programs in 1971 as a methadone program, and we have grown over the last 50 years to become one of the largest behavioral health, comprehensive behavioral health providers. We serve infants through older adults, mental health services, services to persons with developmental disabilities, and as well as are a proud and substantial provider of substance use services in our community. I am here representing the Detroit-Wayne Association of Substance Use Providers. I am their co-chair. I see a number of my colleagues from that group on this meeting as well, so I want to make sure that they are welcomed and appreciated. We are an amazingly tight and compassionate group of professionals that provide substance use treatment services across Wayne County. Our organization represents 25 community-based nonprofits that provide a full continuum of substance use treatment services, largely funded through the Detroit-Wayne Integrated Health Network. So the next slide shows the organizations that are part of our organization. I should point out that I'm also treasurer for the Michigan Behavioral Wellness Collaborative. So proud to be part of both of those groups. To talk about the impact of COVID-19 on our substance use disordered persons in Wayne County and the service providers. It's important to first point out that the substance use consumers represent one of the most complex populations that we serve. Persons with serious substance use, long-term substance use disorders typically and frequently have multiple physical health conditions as well. So they have been particularly susceptible to the COVID-19 infections and have presented with additional challenges. Not that the mental health system has not experienced those challenges, but our challenges in the substance use area have been different. One of the main differences is that many of the services that are provided through the Substance Use Network are residential, communal living-based services, such as detoxification, short-term and long-term residential programs, recovery homes, and domiciliary IOP services. So these services all stayed open, and I would like to point out, and we tried to point out, that we were not recognized as, nor were mental health providers or providers of IDD services as essential healthcare workers for quite some time. It was quite the challenge to keep our staff motivated. And the Substance Use Network, we had extensive illness amongst our staff as well as amongst our consumers. Like the whole world, we were not prepared to address a pandemic. We, of course, as healthcare providers, were prepared. We have the person who comes in with an infection. We're prepared for infection control. We're prepared for our population has more TB and has more hepatitis. But we were not prepared for our entire population and staff to need to be protected from this virus. And as a consequence, we suffered greatly for a period of time. I'd like to say that we got good support from Detroit Wayne Integrated Health Network. We also supported each other a great deal and preparing and finding resources. I would like to also say that while the first 6 weeks were very difficult, many of us closed our doors to new consumers. Unfortunately, we needed to went into a self-quarantine type of situation in order to protect the people that were already admitted into our programs, as well as to protect our staff. And in many cases, so many of our staff were ill, we just couldn't admit because we didn't have the staff to take care of people. So along the same lines as mental health, in terms of our outpatient services, we're also experiencing a reduction in people seeking services. Though on the substance use side, we're actually seeking, we're experiencing a much higher percentage of reduction in people seeking services. Now, we know absolutely that that is not because people are not using substances. We know that people are not abusing opiates, that we know that alcohol sales are 500% on the increase since COVID-19. So we know that our community has significant problems. But people are not seeking services, and we can only guess. Some of it is shelter in place. Some of it is that the external pressures for people to seek substance use services, which is frequently one of the large motivators, like courts, work, just family, that those motivators aren't present for people. So we're very concerned about what we're going to find when we reopen. We also faced additional challenges of equipment as we transition to telehealth services. Our population, the substance using population, is a more transient population. They're more impulsive. They're less focused on having a long-term phone or having access to computers. So we found it much more challenging than on the mental health side to be providing services through telehealth modalities. That doesn't mean that we all didn't experience that shift, and everyone is offering those services, but it's been a much greater challenge. Our increasing costs of doing business are obviously the same. PPE, when you think about a residential facility, though, you need to think about gloves and masks and sanitizer for everyone who's there, and multiple times during the day cleaning facilities. Whereas in outpatient services, I think most of us have stayed open for our mental health services, at least at some level. Most of our services are telehealth. On the substance use side, many services stayed open for people face-to-face. So if we're looking at the short and long-term impact on providers, so our fee base is very similar. Fee for service for all outpatient services, and our residential services are paid on a per diem bed basis. Because of social distancing, most residential providers had a period of at least a short-term closure and have reopened, but due to social distancing are operating at on an average of about 40% less available beds in the community. So we have both the consequence, the financial consequence to the providers of not being able to open up beds, as well as the financial consequence to the providers who have budgets and buildings and indirect costs that don't change based on a 100% census or 90% census, and we're operating at 40% reduced expectation. And there is no reason to think that that is not going to change. We need to prepare that this will be long-term. Our current levels of reimbursement don't support operating facilities at a lower number of beds. We know that we're going to have to continue to purchase PPE, and we're going to need to continue to purchase those at a high rate, again, because of our large number of residential services. It's also important to recognize that many of the substance use providers are smaller agencies. Unlike many of us who provide a more comprehensive service, mental health services, we tend to be larger organizations, more comprehensive, bigger community service. But SUD providers tend to be much smaller with budgets from under $1 million on average to $4 or $5 million, where you're looking at mental health providers upwards of between 20 and 40 million for many of us. That's not to say that the devastation to the mental health network doesn't need to be addressed. But the concern is on the SUD side that the substance use providers are not going to be able to operate once their PPP loans are gone. It's been a wonderful opportunity, and we are all very appreciative for those PPP loans. But once they are gone, it's been a very false sense of security for many that when they're gone and people are trying to survive on simply their revenue, that our businesses are going to close. And again, substance use businesses closing does not mean that people will not be using substances. We're going to continue to see people overdosing. We're going to continue to see that in unpleasant places on the street, in emergency rooms. We're going to continue to see people in hospitals from alcohol toxicity for people who are abusing other drugs as well. In short, we know that self-medicating is occurring, and that we look to your leadership and your assistance to emphasize to MDHHS that in order for the services that are necessary for our community, for the persons who live in our community to be able to live well, that additional funding is needed. And I thank you very, very much for your time and interest. And I believe I'm handing things off to Mr. Willie Brooks.
We're going to get to Mr. Brooks in a second here, because he's going to, the Detroit Wayne is at a little bit of a different level than the provider level, and he has some other things to talk about. I want to discuss with the providers first, what you're facing out there. And I really thank everybody for getting a hold of us to lay this out. I will say that I am a Wayne County member of the board of the Detroit Wayne Integrated Health Network. I'm the treasurer of that board. So these discussions have been going on for some time. Ms. Leisman, I'm going to go to you with my questions. You were talking about spending down reserves. Now, the mental health, I should say before I say that, the Mental Health Authority contracts with everybody that was presenting today in order to provide services. So we have contracts with everybody you saw today to deliver these services. Ms. Leisman, you talked about spending down your reserves. This has been an issue for the Detroit Wayne Integrated Health Network, where the state policies have said, nope, go spend your reserves. So we pretty much spent all of ours. What is the situation in terms of how much reserves, because it's going to get uglier before it gets better, what kind of reserves do the providers have out there anymore?
Okay, so I'm going to be a little bit more general because that's not a question we've asked each other. However,
okay.
I do know let me say a couple of things. Number one, as a nonprofit that has other books of business, our reserves are not just behavioral health. For example, in my organization, I have other funding from other systems or foundation funding that might be part of some of my reserves that have been received over time. The other thing I would say is that because many of us got the PPP loans, the payroll protection loans, and this year there might not be as much of a risk, but we know going forward there is much risk. And then in terms of financial health, our boards have to be financially responsible, and we have to figure out how to operate on the current budget year and operate and with no margin or slim margins or continuing to dip into reserves. There's no way to have a positive financial outlook from funders or from banks if you're trying to secure loans, all the things that would make as a private nonprofit, you'd be at risk for. So I understand what the state might be trying to do, but I think it's a fallacy to think that spending reserves is the way to handle all of this situation. And I think that we see what has happened at Detroit Wayne Integrated Health Network, and it hasn't been beneficial to them. And I don't think there are many of the providers that are really on a very small margin in terms of just even cash available.
At some point, I think, Ms. Leisman, both in my role here at the commission and at the authority, if we can have an idea out there of the providers and how much they have left of their reserves, has it gone down by 30%? Has it gone down by 50%? We're talking about providers that will have to close. So I think that'll help the discussion going forward when we know. You also mentioned, Ms. Leisman, the $5 million that came to the state of Michigan. I believe you're referring to purchasing a PPE, because we also have the PPP. So this is the personal protection equipment. Of that came to Michigan, Wayne County got $500,000.
Yes.
So we got, sorry?
That's my understanding, correct.
Yes, so we got 1/10 of the amount of money that came to Michigan for PPE, and we have basically 25% of folks that are receiving services. So that was way out of whack. Ms. Leisman, I don't know if everybody on the committee understands, but when we're talking about clubhouses and how that is stopped, can you please describe for people what a clubhouse is and how important that service is?
So a clubhouse is a psychosocial rehab program that takes persons that have severe mental illness, and it's a work day. They learn work skills, and they usually move from the clubhouse, which is they can be open every day. There's membership. They learn leadership skills, and then they move from there to transitional employment, and then from that to employment, or they might move straight from the clubhouse to employment. So it's a way to really help people become more independent, learn leadership skills, learn work skills, and it's a very positive thing for people who usually have had histories of multiple hospitalizations. The other thing that it provides for social interaction from a very positive level, and it's really from a recovery point of view. So you're really looking at helping people really have a quality of life that is better in the long run. The other thing I would say is, as Brent talked about with the IDD, in a similar way, because it's a congregate setting, we're only now bringing people back, but we have to look at social distancing, we have to look at changing facilities and the cost of facilities. So that's a sort of a hybrid of a couple questions.
And a lot of the clubhouses actually have consumers that kind of run them. So it's a peer-to-peer conversation that goes on that is so important in those clubhouses. You talked about the telehealth costs. Can you give me relative for the reimbursement for telehealth services versus what the cost was when you could meet people face to face? how much revenue is being lost on a percentage basis, if you have it, for going to telehealth?
Okay, so we're currently being paid via telehealth the same fee as if we're being seen face to face. The state made that determination. However, the difference is that, for example, with working with children and families, you might have seen them for a 45-minute session and seen their parent and child do a family session for another half hour or whatever. Now, via telehealth, a lot of times parents cannot stay on the phone that long, or they can't, the connectivity is difficult. And so you might have multiple claims, but it'll be less money because it is less time with the person in terms of the encounter. And I think the other thing is that terms of minutes on the phone, many of our consumers either don't, they only have a shared phone, or they don't have the kind of plans that require the video with an iPhone, that kind of thing. So there's multiple reductions in that respect. And then just trying to set up an appointment and making sure the person's there at that same time that you've had the appointment set up. And so you might have to have multiple reach outs and outreach to the person to make sure that you can connect with them in the same week.
I will add as an editorial comment that we're losing the human in human services. I'd like to ask Starfish, you dealing with children, you indicated you're going to lose perhaps 600 clients or have lost as a result of the financial strains. What does that represent in terms of the percentage of the number of clients that you were serving prior to COVID?
Well, I'll clarify that right now at these current funding levels, without some sort of support to get us through this crisis, we are billing at about 65% of our historical funding levels for the reasons that Ms. Leisman just pointed out. So if this trend continues, if we get a second wave and this trend continues through next year without some funding relief, we are going to have to lay off 30 clinicians to make up for that lack of funding, which then will translate to 600 less children being able to receive services once the situation becomes more of a normal operating type of situation. Our big worry is if we have to lay off those 30 clinicians because we don't get the funding relief to maintain our workforce, when the situation, the COVID situation becomes better, and then we see all of this mental health need that is going to be out there in the community to help us recover from what we just went through, we will not have the staff and we will not be able to get them back at this point. So we will have a serious capacity issue. We already had a serious capacity issue with children's services. We were working very closely as a provider collaborative to try to recruit and retain behavioral health staff to work in Wayne County in particular. And we're very worried that if we have to lay these staff off in order to continue to sustain our organizations within in the situation where we don't get funding relief, that we will just not be able to get those staff back, and we won't have the capacity to meet the need in the long term.
Yeah, thank you. And I think Mr. Brooks will be speaking about a lot of what's going on in Lansing and how the money is being moved around in there too, as we're looking for more support. Services to enhance potential. We used a lot of alphabet soup here, but you good folks do job training for developmentally disabled and actually providing jobs. Also, you get jobs through STEP. And Mr. Mikulski, you mentioned the 7% cut. Now that's a cut coming from the Detroit-Wayne Integrated Health Network. And this goes to the complications of what we're seeing right now. We also have had our reserves really hurt from the policies of the state. And so we're all making decisions either at Detroit Wayne Integrated Health or at our provider level of survival decisions that are being made. The 7% cut was for a fee for service. In prior years, Wayne County was reimbursing at a higher level than other places around the state. And so we looked at that and said, we're going to bring it in line with the rest of the state, but then that puts it on our providers. So I wanted to be clear on what that 7% cut was. I also just want to make a comment on SUD, because I've been involved in this right since the legislature said you're going to have an authority. The SUD providers, the substance use disorder, Detroit ought to be proud of what the history has been here. In most, if not all communities around the country, if you walked in and you said, I have a drinking problem and I want to kick it, almost all places around the country would say, great, come back next Thursday for an appointment. In Detroit, you walk in and you say, I'm a junkie and I want to get well. You're immediately given a bed. And so we were really unique. 500% increase in liquor sales. Is that correct?
That is correct.
Wow. Yeah, so we're going to be, so hopefully somewhere in this discussion, we're going to get to what the Integrated Health Network, the Wayne County Commission, and the providers can do in common to have our voice heard up in Lansing as well as DC. I'm going to go to commissioners now for questions, and we will start with the Vice Chair, Commissioner Baker McCormick, if you're ready, ma'am.
Yes, I am. I'm sorry, I was muted.
Do your thing.
Thank you, Mr. Chair. I've been an advocate for mental health, and especially around this time where we're dealing with the aftermath of COVID. And my district in particular, it has been hit the hardest in the state of Michigan. So I'm really concerned, and so I drafted maybe about a month ago, I guess, a resolution to help and support your organizations and the need for more funding, because we know that we will have a spike in mental health issues. So I'm on board to do whatever I can to help with the funding needs. And so I just wanted to let you know that I'm very supportive of that. Thank you.
Thank you, Commissioner. Questions, Commissioner Anderson?
There we go. I have probably more questions because I think a lot of those issues that I have been laid out, and to see if we have some type of a course of action that we can provide some relief to these organizations, the providers that are running into serious financial issues. And I know we've got an issue with the with our county representatives too, with what's coming down from the state. One of the things that I will be speaking to is the St. Louis Center. Starfish, I'm aware of the problems that they're having, but I think that's been laid out pretty well by the representative from Starfish. I don't know if we have anyone here from the St. Louis Center, but I don't think they fall under either of those groups. I don't think they were the associations, I should say. So I don't know, Mr. Chair, if at some point, if you can ask if there's anyone here on the call from the St. Louis Center. But
I think you just asked, Commissioner.
yeah, if somebody could.
Is there anybody on the call from the St. Louis Center? I see we have something like 40-some people on the call, which I am glad to see those numbers.
Mhm.
Anybody from the St. Louis Center on the phone? I don't know how they would notify us. I guess they could raise their hand or something.
Maybe they could unmute for temporarily.
Yeah, I don't know how that works. But Commissioner, let's move on. The ask is out there. Maybe they have to unmute or something, and we'll get to them in a couple of minutes. But anybody from the St. Louis Center, you could notify us. Do you have other questions, Commissioner?
Not at this time. I'm interested in seeing how we are going to try to address these problems. We could very likely lose some of these providers that we really need to have their existence not guaranteed, but
No.
you know, that we will have them around.
Well, as Mr. Brooks will talk about, we have somewhere around 300, 320 providers in Wayne County, and most of them are small nonprofits. So there is going to be a winnowing. How big, we don't know. Questions, Commissioner Anderson?
I'll hold off until after Mr. Brooks.
Okay. Let me go to Commissioner Dobb then.
Thank you, Mr. Chair. So I don't have a question specifically for anyone in particular, but just a general question that I'm going to throw out there, and then whoever feels best that they can answer it, I guess just go ahead. So my question is there an expectation that the need for mental health services will increase as a direct result of the stay-at-home order? And is there any sort of, has there been any sort of formal analysis to back up that expectation, or that, the anticipation? And if there has been, like, what sort of data are you looking at to back that up?
I can respond to that somewhat. So there are many studies out there post other tragedies, and we would call COVID-19 a tragedy that's causing trauma across our community, and the resultant mental health consequences, namely depression, anxiety, as well as substance use as people recover. The data shows that the expectation of the recovery period is about 4 years. So most intense once people's fears reduce and they start seeking services, and then a longer term impact for persons of all ages. Higuera Health is the crisis service provider for Wayne County's adults. And I can tell you that what we've experienced, what we didn't expect, but what we did experience, has been a substantial reduction in requests for crisis services during COVID-19. So we are very concerned that with the opening of doors and people feeling more comfortable, that we are going to see a flood. We have seen in the past 2 weeks, we have seen about a 20% increase in requests from crisis services, over the month of April. So April dropped very, very low. We are not quite at our prior level of requests for crisis services, but we are edging very quickly in that direction. And we're seeing it very rapidly over the last 2 weeks, a substantial change. So that to me is our community indication that it's beginning to open up, and that we are going to need to be able to reach people promptly. I can tell you in our SUD treatment services, because of social distancing, because of the issues that are going on, we have people calling and begging to sleep on the floor because we had to reduce our bed capacity and are not allowing the normal 45. We've reduced 35. And there are people out there now begging for help, and we can't help them.
Okay. Okay, thank you.
Anything else, Commissioner?
No, that was all I had. Thank you.
Commissioner Marecki, please.
Thank you, Mr. Chair, and thank you to all of you for this presentation. And I'm looking at the last slide, I believe, about your ask to us, which I appreciate you spelling it out like this. I'm on Ways and Means, and we're not even going to be able to start debating the next budget till the end of July because there's so many moving parts in all of this, and they're trying to get a handle on how much our budget's been hit. And at the state, it's the same thing. So I guess one of you touched on this. Well, two things. It's my understanding that monies are being held at the state level until everybody uses everything they can, and then they'll disperse it. And maybe Willie Brooks is going to address that. But someone also touched on the fact that you have some private business fundraising partnerships, and businesses have been hit terribly. But are you hearing from any of these supporters in any of these businesses, and maybe people that do some kind of fundraising, that they are here to help with any of this budget shortfall for all of you?
This is Brent. I can't speak for all of the businesses and all the partners that we have, but I do know that a lot of our organizations were extremely thankful and appreciative of a number of the foundations that we work with, that we have received financial support in the past for a particular grant or a particular program, that they were kind enough to have some of those funds refocused toward COVID-related expenses that were unexpected. So programs that were previously supported for whatever purpose, those funds were able to use for telehealth, ramp up, PPE equipment, those type of things. So that helped, that will continue to help the long term with how we're going to be looking, how we're going to be programming post-COVID as well.
Okay.
I can piggyback on Brent. At Starfish, most of our funders, our private funders, have allowed us to repurpose our grants to provide operating support during this crisis. And we have been extremely fortunate that we have been able to do that, because it's what really has allowed us to continue to operate during this crisis. And they are also being very supportive in our efforts to try to increase access to telehealth, to provide technology to our consumers. The worry is that this is not sustainable. So this is one-time funding that we have right now to help us navigate through these couple of months. But in the long term, unless we get some sort of relief from the system, those funds aren't going to be there to continue to sustain us.
So I would also follow up with what they have said, is that we, one of our issues is we had about $4 million a month that we've had reduced dollars revenue for our services since mid-March. And so those dollars, when you add them up across the 17 providers, that's why some programs are going to have to close, and smaller providers are going to have probably not be in existence or be absorbed by other people, because when you keep multiplying 4 million per month, you really are, no company or business is going to be able to come in and really support that, and let alone today, but sustain it over another year.
Okay, thank you. I appreciate that. I'm all set, Mr. Chair.
Thank you, Commissioner. And I do think what we can definitely say here is, if we do have a bad second wave this fall, we're really in trouble because we're already straining the limits of what can be provided publicly and privately and through foundations to support these services. We get a second wave of any kind, and we're really in trouble come September, October, November for providing these services. For right now, do any commissioners have any more questions for our providers that are out there?
Mr. Chair?
Yes.
I know this is your first time on an actual physical
Yeah.
Zoom.
What am I doing?
No. I didn't know if you noticed that Mr. Brooks says he has another call at 3 o'clock.
Yeah, we're going to go to him now.
Okay.
No, and I didn't notice, and I don't know where to look for it. So,
Yep. Just
but
wanted
that's
to
why I
tell
wanted
you.
to. Yep. So thank you for hanging out, Mr. Brooks, through this discussion. If we could get the quick outline up on the screen for people that Mr. Brooks submitted for the comments he wants to make. We're going to a little bit of a higher level here. What's going on at the Mental Health Authority of the Detroit-Wayne Integrated Health Network, as well as what we're facing at the state of Michigan. If we can get up that Word document.
Yep,
So-
1 second.
Yeah.
I can.
And Mr. Brooks,
talk now.
please start in.
Okay.
Willie
'cause-
Brooks is the executive CEO and president of the Detroit-Wayne Integrated Health Network. Mr. Brooks.
Thank you. One, I want to thank all of the providers and their comments. We definitely went through a lot of change and challenges through this COVID-19. And I just want to mention a few things briefly. One, it is obvious that we have a problem trying to match actual services with actual funding. There's been a tremendous strain on the system to over-service based on the funding that we're receiving. We managed to take some of that pressure off by spending our reserves over the past few years. Now we have completely exhausted all of our reserves at the authority to the point that we created an overspend of $50 million. So we're working on trying to balance our budget from a $50 million overspend because we continually set a higher rate of spending by spending reserves. And spending reserves is just like using your credit card for monthly bills. Eventually, you're creating an environment which you cannot sustain. And that is the issue that's out there. The service need is tremendous. There's so many aspects of what we do that are being impacted financially. We were hit with different audits from the department, basically stating that they were giving us funding for people who were deceased to the tune of $9 million. Our autism benefit is an overspend of $20 million. So there's several things out there that are directing this, and I won't go into all the details, but I just want to mention two categories. One, I just want to talk a little bit about what we project in the future. We know that COVID-19 is going to have a higher demand for service, as stated by many of the providers. Alcohol sales just nationally, I don't know what they are exactly for Michigan, but I do know nationally that they've gone up 55% in the store and 243% nationally, which is tremendous. We know that domestic violence has gone up tremendously, which adds to the trauma. We know that there's child trauma out there and student trauma with the changes in their school. We know about, of course, the health trauma, but then we also know that there's economic trauma out there, individuals who cannot pay their bills, who cannot find employment, who are fearful for going out looking for employment because of COVID-19. All of those items will have direct impacts on the community mental health system. And that is why it's so important to maintain a healthy provider network during this critical time. So what are we doing? What are we doing as the authority? I think that's what everybody wants to know. And I'm going to give you just three basic things that what we're trying to do. One, we are trying to update the mental health code so that it's a better reflection of how we're being funded. Right now, the mental health code basically states that providers have to take in individuals, that they can't refuse services because of cost, that individuals have different types of choice and variety of the type of services that they can have. It is directed and driven by that individual. And quite frankly, the way that mental health code is written, we cannot afford to issue services at that unlimited amount. We can't do it. You know, there's some people out there who are grandfathered, who are receiving more than others, but we cannot afford to continue to offer unlimited benefits with limited amount of funding. That is something that is a statewide problem that the legislature and the department is going to have to resolve. They do realize it is an issue. So the first thing we have to do is make sure that the benefit situation is actually in line with what we have to do, especially when you add the fact that we've added telemedicine, we've added the need for infrastructure and electronic infrastructure. We've added the need for personal protection equipment. All of these things have been added to that responsibility within the last 3 months alone. So we need a realistic approach to our benefit structure and costs. That's the first thing that we have to do. The other thing that we have to do that is important is we have to look at the current level of funding and the amount of revenue that is coming in from the department. We know that every aspect of government is being hit hard with reductions because of tax revenue. The federal government, local government, state governments are all looking at roughly 20% or more in reductions in revenue until we can get back to a growing economy. So we're going to have to address that issue. We're going to have to figure out a way to make sure that the revenue's coming in, that there's some priority that is associated with mental health to make sure that we have the funding that is adequate for that situation. That is something that I am working with the department right now. And then the last thing that we're doing is I'm working with the department to revamp the entire mental health system. Prior to COVID-19, the department was looking at a program.
I'm sorry, Mr. Brooks. By department, you mean the Michigan Department of Health and Human Services.
That is correct. Michigan Department of Health and Human Services was looking at a program of integrated provider network, especially integrated provider networks. They were looking at ways to integrate behavioral health with physical health as it relates to funding. So there's some restructure that is going to occur in the system. The goal is to increase efficiencies and to provide a higher level of service for the people that we represent. Those three activities are occurring right now. They're looking at their budget, they're looking at the mental health code, and they're looking at restructuring the system. We must address those issues so that we can also take care of many of these needs that was mentioned by these providers. There's some funding out there, we know, but we want to make sure that that funding is used in such a way that can help sustain us through this challenging period. So that is what I'm trying to do on my end, to unlock some of those immediate funds, to look at those different processes that are out there, and to have a realistic budget approach that is not based on spending reserves or providing services that are not funded. So that's it in a nutshell.
Yeah, and there's 6 pages of what you submitted. So I do want to encourage commissioners to read all 6 of those pages. There's a lot of things going on. And here we are in the middle of the crisis, and we're redesigning the system at the same time. So that presents its own challenges. Do you have time for a few questions, Mr.
Sure.
Brooks? Okay, I see the 3 o'clock. So we'll go around. I do think I see Commissioner Anderson's hand, but I'm going to go around like I normally do. I'm going to go first to Commissioner Baker McCormick for any questions. Our Vice Chair.
Yes, thank you, Mr. Chair. I have no questions, just here to make sure that you know that I'm in support and we're going to try to do what we can to make sure that the funds are available.
Thank you.
Thank you, Commissioner.
Thank you.
Yep, thank you. Commissioner Anderson.
Thank you, Mr. Chair. Mr. Brooks, I appreciate the difficult situation that you're in, and the providers as well. But specifically about the St. Louis Center, after speaking with them on the phone, they said, they mentioned the 7% cut, and I think that's been established that that's coming or has already taken place. Is there any plans to go after, for lack of a better term, a clawback, to ask refund organizations, including St. Louis Center, to repay money that they've already received?
No, we're not asking anyone to repay dollars that have been received. That 7% reductions was put in place because we were facing a $50 million deficit, because we created a budget that was not sustainable, because the budget was based on spending reserves. So now that reserves are gone, you've created this elevated spending because you used a false budget, and now those dollars are no longer there. We were able to delay that 7% reduction for 6 months until the next fiscal year, which starts in October. We communicated that to our providers. I do not know what's going to happen in October. I do not know if we're going to have additional funding. I do not know if they're going to try and reduce this by 20%. I'm not really sure what's going to occur. So our assumption is that we're going to have a 7% reduction with this fiscal year, pending some large increase in the funding that we receive from Michigan Department of Health and Human Services.
And I would just like to add, Mr. Brooks, Mr. Anderson, Commissioner Anderson, and you're well aware of this. We've already discussed how the state policies have caused the providers and the mental health authority to basically run their reserves down to zero. And then in this redesign of the system that's being discussed up in the legislature, so those state policies have caused us to run our reserves down to zero, and then when it gets onto the floor of the House and Senate, we get beat up with that. See, these people can't manage their own money. We got to, so we will have a little discussion right at the end here about next steps, positive steps, and I've got some ideas, but that's one of the things that's going on, Commissioner Anderson. I'm sorry, Commissioner Anderson, you still have the floor.
Thank you. And Mr. Brooks, could you provide us, and I don't know if in this handout or that you provided, has it been sent to us, Mr. Chair, in a paper version of the package or online version?
Yes, you got it twice, Commissioner Anderson.
Okay, all right, I'll look again. But I wonder, does it have a perspective, like a historical perspective, on what the mental health service organizations have received, what comes into the mental health authority over the years, and even through its name changes, say over the last 5 to 10 years, so we could see, from a historical perspective, how much that's decreased per patient, and also how much the services have changed over the years.
That's not in Mr. Brooks' report, but I think when we're talking next steps, and I'll raise it in a minute, I think that perspective would be good for commissioners to see as we're going to have to do some lobbying here, folks, for funding. But no, that is not in Mr. Brooks' report.
Okay, one last question, if I could, Mr. Chair. Mr. Brooks, the St. Louis Center had indicated that services that they had always provided, or for a number of years had provided in a group setting, there's a change in the way the compensation there's a change in that compensation method. And I just wondered if you could speak to that.
I'm not familiar with specific change, and I don't really want to guess what that actually is. I do know that there were a lot of changes, as mentioned by the providers today, because of the inability to have face-to-face visitations and the inability or undesire of individuals to go out in the public.
Right. Maybe if you would check into that and get back to me, I'd appreciate it.
Right. Yeah, because I was not aware of any reductions.
Okay. Thank you. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Dobb?
No questions for me. Thank you.
Thank you. Commissioner Marecki?
I just have one quick question. Mr. Brooks, you mentioned that right now providers have to take everyone who comes through their doors. Is that a state law?
Well, we have a, as a mental health provider, we are a safety net. So we cannot refuse certain services. The providers have a clear distinction of some services that they are required to do and those that they don't have to do. But we cannot, as authority, refuse individuals.
Okay, and is that just incorporated into the authority?
It's part of our agreement with the Michigan Department of Health and Human Services.
Okay, all right, thank you.
Yeah.
And there also are requirements in the mental health code
Yeah.
with regards to that.
Thank you.
Okay. I want to thank everyone for presenting today. One thing that hasn't come up in this conversation is as we're looking at our criminal justice system, there's going to be, for policing and for in our jails, there's going to be increasing focus on providing mental health services. So that's coming in our future, in addition to everything else that we're doing out there. And I don't know it was a very good list of our ask from our providers. And I want to suggest here, one of the things you said was small business grants like we did for, grants to nonprofits like we did for the small businesses. A quick back of the envelope number says if we were able to provide $20,000 grants to 200 of our providers, that would be a pool of $4 million. So we need to have that conversation. I'm suggesting here, and somebody tell me if I'm wrong, that leading into the county's budget cycle here, we need to have the administration, the Wayne County Commission, the Detroit Wayne Integrated Health Network, and the provider group sit down in one room. Because what's happening is that since there's very few dollars anywhere, everybody's protecting their own budget. And I would like to get that group together to look at the overall system that we're all going to have to make sacrifices for, but let's do it in a smart way. And in that group, we can also have our Lansing lobbyists to talk about what the ask is up in Lansing. But can somebody tell me if I'm wrong that we need representatives of the commission, the county executive, the provider network, and the Detroit Wayne Integrated Health Network to sit down together and have a frank discussion about who has what kind of resources, what is really needed out of Wayne County. That's the idea I'm going to throw out because we have to make it forward. Does anybody have any comment on that?
Yes, Mr. Chair, I do.
Yes, Commissioner Anderson.
I think that it's a great idea. I think we also need to have our lobbyists present so they can get some direction from the issues that we're dealing with here at the local level. And so they can help us in Lansing, because as far as seeing some initiatives that's being pushed, I'm sure they can get someone to sponsor it up in Lansing and to start when they're starting in their budget process. because theirs is going to be a convoluted process this year because of what happened there.
Yeah, and
Always.
Mr.
and
Chair,
Commissioner
Mr.
Anderson,
Chair,
I
you
have no
correctly-
idea. I mean, this has been talked about up in Lansing for a few years now, at least. I have no idea what kind of conversations the county lobbyists, if any, are involved in. So yes, we need to have them in the room. Ms. McRill from the
Yes.
former Northeast Guidance Center, now the Northeast Integrated Network. Is that what you are?
Yes, you do represent us well as our commissioner here on the east side. Thank you very much. I was just going to say, as the co-chair of the Behavioral Health Collaborative, we would be delighted to sit down with this group, to sit down as we are the people with the boots on the ground and share our ideas and do brainstorming with this group to come up with adequate funding for Wayne County.
Yeah, and administration is present in this meeting, and so that's the message to administrators. I'll be following up with a phone call. Does anybody else think this is the right approach for us to do here in the next month or so as we get ready for the county budget and then the state budget? Is this the way to proceed?
I think it's a good idea. I think it's going to be a very difficult discussion through this whole budget, frankly. But the more people that are involved in different areas, I can't see how it would hurt. And like you said, the administration's on this meeting right now, and the whole thing is overwhelming, I think, with this next budget. And just listening to all of you today, every single area has gotten hit huge, and there's a lot of people suffering out there, frankly. And so, yeah, I mean, I would support that as well, just for a discussion.
Well, and it will be ugly because, you know, we really have to have people to be honest. What do we really have? What do we don't? Because as these services diminish, costs are going to pop up elsewhere in our budget as people are not receiving the services and the services are diminished. So we are going to be paying for it. So we need a hard-headed, what does the mental health authority have? What does the county have? What do the providers have? How can we make this work and hope we don't get a second wave? Mr. Brooks, is that an appropriate approach?
He may have gone.
Oh, he had to go to his meeting. Okay. Anybody else want to comment? We will get to public comment in a minute, but anybody else want to that's participated in here want to have a comment as to whether that is the proper approach right now, so that we can get to our ask list. All right, well, that's what I'm going to do. So Mr. Sharon and with the collaborative and the county exec's office, we're going to get something together here in the next few days so that we can have a sit down or a Zoom down meeting to really have a very much an honest discussion about what's facing us and what we can really do. Any other questions for people that from commissioners on this discussion? Well, hearing none, I will roll the agenda. What is next, Madam Clerk?
E, such other matters as may be properly submitted before the committee.
Yeah, I contacted the administration. We have a big event, and I guess one of the commissioners was out there. Does somebody want to tell us from administration what's happening briefly, what's happening out at Garden City Hospital today?
Hi, Commissioner Kleen. Yes, I'm still here. Carol Osterberry from.
Hey, welcome back. You'll be on that other discussion too, Carol.
Oh, I thought you wanted me to talk
No.
about. Oh, okay.
This is good for now, but on the other discussion coming up a week from now, we'll see at that one too. On what we can do in our budget. Anyway. Please,
okay.
Yeah, please tell us what's going on.
Anyways, yes. So Garden City Hospital, in partnership with collaboration with Wayne County Health, Wayne County Administration and Health Department as a response to COVID-19, we have been able to get a phenomenal program for COVID-19 testing that includes the COVID-19 diagnostic testing as well as the antibody testing. Many Wayne County employees have already gone through the drive-through testing site. You know, a little bit of that. We wanted to get our Wayne County employees tested. Plus, it's kind of good to, when you roll out something as big as this, to have, you know, some trial run, you know, practice runs to make sure if there's any kinks in the system. And so that happened. And today then is the official announce and launch of this is open to the public. It is Monday through Friday. I know it opens at 10 a.m. and I think goes until 5 o'clock. The public does not need to have an appointment and can just go up and get the testing. They do ask for a copy of identification, you know, driver's license or other form of identification, and health insurance. And then they log you into their lab information system and collect both the nasal sample for the diagnostic testing and a blood draw sample for the antibody testing. And then they give you information on how to create your own patient portal through Garden City Hospital. You can look on there for test results, and it's just a great service.
Thank you. Do you have a list of all of the testing locations in the county?
You know, the best place for the list of testing is on our website, because that does change and we link directly to the state website. We don't just keep a running list, because new sites come up all the time and other sites get dropped off.
But you know, I've looked at that list too. So Wayne County doesn't have a list of this is what's happening in Wayne County. The link
like
is
I said,
through
the most, we work to try to do that. And then
Yeah.
we're finding the most accurate way is to link right to that state website.
Okay, because that's not always accurate, but thank you. Any questions folks have on the Garden City?
One that, Mr. Chair.
Yes, Commissioner Anderson.
One of the things I think that I may have missed it, but I don't think Carol mentioned, is that there's no doctor's note required for this. There's no referral required. So anyone with an ID can just get in line and have the test done. I think they do ask if you have insurance, but if you don't, it's not a requirement.
That is correct, Commissioner Anderson.
Thank you. All right, thank you for that update, Ms. Osterberry. Thank you very much. Madam Clerk, next item.
Public comments.
Okay, so we'll take public comment. Anybody on Zoom, has anybody submitted public comment through email?
I haven't gotten anything.
No.
Okay. I do have the list in front of me of who the participants are, and there's a couple of individuals on there. I hate to call people out, not calling out, but there's a lot of great folks on there. But I see Mr. Vaughter, Dwight Vaughter is on the call. And Mr. Vaughter, we've gone through a lot of battles over the last 6 years. I'd be curious as to your public comment on what you heard. And the other, I believe the T. Adams would be Tom Adams, who serves on our SUD advisory board over at the Mental Health Authority at the Detroit Wayne Integrated Health Network. And Mr. Adams, if you had some comments too. Mr. Vaughter, would you like to have comments?
Yes, sir.
Yes, sir. Good to see you.
I am very supportive of what my colleagues said on both the mental health and the SUD side. For SUD programs, though, as was indicated, most of us in Detroit, especially, are very small organizations with very small budgets. And most of our funding, if not all, comes from Detroit Wayne Integrated Health Network. And if we do not get relief, we will not be in existence. And that's a shame. After 50 years of service providing for the challenged population in this area, it's really scary for us to go out of business because there's so many people that depend on us. And I'm very supportive of what I've heard today, and I hope some assistance come real quick. Thank you very much.
Mr. Vaughter, would you identify what organizations you're associated with?
I am with SHARE, Self-Help Addiction Rehabilitation, better known as Share House, right there on 1852 West Grand Boulevard. We
You
are
got it, baby.
withdrawal, residential services, outpatient, recovery housing, the full continuum of services.
Share House has been doing it forever.
Thank you.
Thank you very much, Mr. Vaughter. Mr. Adams, are you there? Would you care to have comment?
Commissioner Kling, actually, the T. Adams you see this is Terrence Adams from the fifth grade.
Not who I thought it was. All right. Does anyone else wish to have public comment at this point? I'm going to put the call out for public comment. One last time, a call for public comment. Hearing none. Madam Clerk,
Adjournment.
pleasure of the committee.
Move adjournment.
So moved.
Without objection, we stand adjourned. Thank you, everyone, for hanging in there for a couple hours. Thank you very much. Now, how do I turn it off? I guess leave. Leave is the thing. I'm leaving, I guess.
Yes, sir.
I don't know. Leave.